Poor wash facilities constrain poor communities from accessing improved livelihoods and decent living. These communities, like many others in developing countries in the West African sub-region, has poor wash facilities and services. They are mostly inhabited by settlers who have migrated from different parts of the country. The city's poor communities lack access to basic water and sanitation service. Rural communities mostly do not have access to water, sanitation, and hygiene. The lack of access to basic water and sanitation services in the poor rural and urban communities puts a lot of pressure on the environment and available facilities. On the most recent coverage data in 2010 on sanitation, Ghana has 7 years to raise coverage from 18% to 61.5% in the urban areas and from 7% to 55% in the rural areas.
The challenge is in the area of the sanitation. Looking at the year, and as the year moves by, it means that we would have to more than quadruple our efforts in the area of sanitation before we can achieve the Millennium Development Goal. All efforts at providing decent or improved sanitation to the people put filter, because a lot of people go by the open defecation. Some also think that sanitation issues should be done by government. And for that matter, all efforts at getting people to provide their own household latrines or toilets, for instance, did not yield much results.
Ghana's sanitation coverage is low. At the end of 2008, the Joint Monitoring Platform put Ghana's sanitation coverage at 14%, and it means that Ghana government, the local government authority, international organizations like WaterAid will need to strike concerted and meaningful partnership with development partners like Australian aid to ensure that we improve sanitation situation.
A total of 1.4 million children die every year, and every 20 seconds a child dies. More African children die needlessly from diarrhea, cholera, and typhoid, a situation caused by poor sanitation, an entirely preventable public health crisis. Recent Joint Monitoring Program update on water coverage in Ghana indicates Ghana is on track to meeting the United Nations Millennium Development Goal. Over the past 25 years, WaterAid in Ghana works with local and international partners to transform lives by improving access to safe water, sanitation, and hygiene in Ghana's poorest communities.
I'm very excited to share with you funding that we have received last year in May 2011. We are excited to be working with the Australian government on a new program called the Australian and African Community Engagement Scheme. We call it the AACES program. This program work is filling a big gap for some of our partners and communities that are in the southern parts of Ghana. What's exciting about the work that we're doing and what is new in terms of the approach that we're using is that it's based on the concept of the strength-based approach. And using the strength-based approach, it assumes that communities, first of all, should lead the development in their areas, in their communities, that they have something of value from which to build upon in terms of their overall development. So it's an approach that does not start from what we call a deficit approach, that there's nothing in the community, that the communities don't have anything to offer, even in terms of determining their water, sanitation, and hygiene needs.
This program with Australian Aid for International Development is unique for WaterAid. Unique in the sense that this is the first time in WaterAid Ghana history that a partnership or a donor-funded program of this nature is focusing on tapping the indigenous knowledge and experiences of community members to reflect in their development processes, and we see this as a unique learning opportunity.
In Ghana, we are implementing the project in Ekwapim North District. We are also in Dangbe West, and we are in the Ablekuma Central Sub-Metro, which is part of our Urban Accra project.
The operational communities are Town Council Line in Ablekuma Central, Sowenya, Nyawunso, Bokokope, Kentenkren, Ejebia in Ekwapim North, Atrobinya, Tenya, Achavanya, Azakope, and Dunyokope in the Dangbe West District. The AACES project partners are Ekwapim Community Development Program, ACDEP, ProNet Accra, and a new partner, Center for Indigenous Knowledge and Organizational Development, SICOD.
We have 3 of our partners who we're working with. 2 of them were chosen because they have been working with WaterAid for more than 15 and 20 years. They have shown to be reliable partners and to deliver well on the various water facilities that we provide for communities.
Even though we have our traditional partners also on board like ACDEP and ProNet Accra, SICOD is bringing some uniqueness in their approach to delivery, and that uniqueness is ensuring that the 3-dimensional worldview approach to development is captured. You know, the physical, the social, and the material dimensions of development, which at least in our approaches to ensuring water delivery, we have never used, these approaches.
The Center of Indigenous Knowledge and Organizational Development, SICOD, is actually engaged in working with traditional authorities to promote endogenous development, that is looking at development from within, where communities use their own local-based resources to bring about development within their own communities. SICOD came to partnership with WaterAid through an AACES project called WASH, and we've been engaging with them for the past 1 year now. And we are working in 3 districts as at now, that is Ablekuma Sub-Metro, Dangbe West District, and Ekwapim North District. In 2011, as I stated, when SICOD came on board with WaterAid and its partners, ProNet and ACDEP, there was a bit of policy change, I should say, that had to do with how partners were engaging in communities and how communities were actually owning the project. And one of the things that SICOD looks at is how to work with communities for them to own the projects that other development workers take to the communities.
ACDEP, one of WaterAid in Ghana's first partner, are engaged in water provision, sanitation improvement, hygiene promotion, and advocacy. With funding from WaterAid in Ghana through AACES program, ACDEP is drilling boreholes in Sowenya, Nyawunso, Okekope, Kentenkren, and Ejebia in the Ekwapim North District. ProNet is another WaterAid in Ghana partner in the implementation of water, sanitation, and hygiene promotion projects.
You have 2 project areas. which are both WaterAid funded. One is for the rural sector, and the other is the urban project. The urban project is the Ablekuma Central Submetro. It's under the Ablekuma Central Submetro, and the rural one is under the Dangbe West District Assembly.
To address the increasing challenges in the WASH areas, WaterAid in Ghana is positioned to expand its work to reach more of the poorest people in the selected communities and the country through services delivery and by influencing policy and practice. This is in line with its vision. In the past year, under the AACES program, WaterAid in Ghana has, in collaboration with its partners and district assemblies, provided iron removal plants, institutional latrines, and facilitated community-led total sanitation, CLTS. Town Council Line, located in Ablekuma Central in the Greater Accra region, is an urban community with challenges with water and poor sanitation facilities. WaterAid in Ghana and ProNet Accra provided an institutional latrine and 2 water kiosks. The situation in the school needed urgent attention, and under the AACES project, Buhari Islamic School is now the proud owner of a modern institutional latrine after the many challenges the school faced.
In the Ablekuma Central Submetro, we are working with schools. We have currently built an institutional latrine for the school there, and they are using it. It is disability friendly, it is girl friendly. We have separate latrines for boys and for girls.
The children didn't have a place to go to toilet, even though there are 2 public toilets around the school. But they don't allow the children to attend to the place free of charge. So each time a child will go there, I have to give them money to pay for it. And they may be in the queue for a long time, and some of them is on themselves. They were using that to play truancy, because they will tell you, Madam, I'm going to visit the toilet, and the child won't come back. So it was giving us a lot of problems. And the place is so stinky that when you visit the place, you cannot be among the people, because the scent that will be on you, you won't like it. So there were a lot of challenges, and we didn't have water too at that time. So we were buying water and so on and so forth. When we didn't have the toilet and the urinal, if a girl child spells herself, it was difficult for us, because this is mixed school. They are mixed with the boys, and they feel shy if the boy sees that he has swelled the dress with the blood.
Through WaterAid and associated partners' intervention, the teachers and pupils would concentrate on schoolwork and build a brighter future together. The facilities provided would go a long way to do just that.
It is going to increase enrollment. Children who are not in school come here to look at the toilet that has been built for us. And I'm sure when school reopens next September, they will be coming for enrollment. We are happy to have toilet and water. And we were even taught how to make improvised running water. When we had the workshop with the ProNet, they taught us how to use the tippy tap to wash our hands. So we are happy. We are very, very happy.
Teachers and pupils were engaged in other initiatives such as drawing competition on sanitation and hygiene and the formation of a hygiene club.
And with this club, we introduced the hand washing as one way of promoting hygiene. So with this hand washing, they were introduced to tippy tap. That is where you have a bottle, you put water in a bottle, then you make a hole, then you use a stick to block the hole, and you hang a soap beside the bottle. Whenever they want to wash their hands, they just remove the stick, then they will be using the soap and the water to wash their hands. That is one of the activities that we introduce as a wash club in the school in order to promote hand washing in the school.
Ganiato, a Class 1 pupil of the school who was assaulted by an attendant at one of the public toilets around the school, expresses her relief over the new facility sited in the school.
I'm happy because when I enter, I don't pay money. They don't cane me. Thank you, WaterAid and ProNet.
The pupils of Buhari Islamic School express profound joy to AACES, WaterAid, and ProNet Accra. Town Council Line benefited from 2 water kiosks to aid community members to access water regularly.
In the Blekoma Central Sub-Metro as well, we have also supported them to construct water kiosks to also help improve the water challenges that they face.
First, I found my beer and new Sanigba on a few. Careful or be a pipe here, time.
Their water flows in the night, so with the provision of the water kiosk, the water is able to store during the night.
Muna zuwa zango wata rana muje abuso kai muje mu dibi ruwa yaran za su suko ba su zuwa da sauri shi yasa wangan nan ya muna sauki mun gode
nsuru mo de abeba e pa se aya ba tan yi adehoro na nsunu na ho ye de nti nsu a se wo de horo adekora no nsu ni bi ni woni nti no na ye sonso nsunu so na ma no kora ni nte se nsu na ba no na ye fo no nsu no itimi sabi e de dware nkwara no e ma won ho te yarwa nketenkete bi e beba ba na ade nyina eto etwa.
It is important to recognize that 1 year after the intervention of this program also, a lot of women who have access to facilities are attesting to the enormous benefit that they are deriving, and they have sent a lot of goodwill messages to Australian Aid for International Development through WaterAid partners and to WaterAid that they are grateful to the government and people of Australia for this support that has come to them to contribute to uplift them from poverty.
WaterAid in Ghana has been working with the Blekoma Central Sub-Metro and chalked many achievements in the area of sanitation, hygiene, and development.
We've had some visits from the Australian parliamentarians who have come to take a look at communities such as Sabanzongo, where we're doing some of our AACES program work.
WaterAid assisted us in diverse ways, such as helping the community to acquire water, standpipes, school toilets. The community, the chiefs, the schools, women, youth, we have all benefited by their training programs and how we can change our attitude for a better community.
In sustaining the facilities, the Watson Committee has contributed immensely to sustaining the projects.
We had a workshop, we were trained, we came back to the community, we talked to our people, we told them what we have for them, and they all accepted it. We went back to our people, we told them that the NGO, that is the ProNet, and then the WaterAid. We give them the report, they said, okay, fine, we'll come to your aid.
They selected some members in the community who will be taking care of these projects, the toilet and then the water kiosks. So they will be running the daily affairs of this thing and see how best the community will enjoy it, and then it will help them. So they are the caretakers of so they named them as Wasam Committee. They gave them training, some 2 days workshop, later other workshop have been organized for them. So I think they participated and it became successful. Now the toilet now is in the school. The students, all the children are happy, the teachers are happy, even the parents who live around, always when they come to the school compound, they express joy on their faces. You can even see it.
In the Dangme West District, 5 rural communities, Dunyakope, Atrobinya, Tenya, Achavanya, and Klebiko, underwent massive wash education and projects. One junior high school, Jokpo DAJHS, was provided with an institutional latrine and a hand-washing facility.
In Dangbe West, we have most about 13 communities that we work through. So we have 3 communities that we give them water. That's provision of water. And then the other 10 communities are CLTS communities.
In the Dangme West District, where they have challenges with their water, there's so much iron in their water, and therefore when you drill boreholes, community members would then leave the boreholes because it colors their clothes when they use the water to wash, and then go and fetch water from the Volta River. And as they fetch the water from, even though initially they'll be using it for their household chores, they end up drinking this water. So what we did was to construct iron removal plants in the Dangbe West districts, and these iron removal plants then remove the iron from the water and therefore purify the water for them to use.
The plant you are seeing is one of the water technologies called borehole. It is a machine drill and fitted with tubes. And then under we have a cylinder, a washer, a rising means, and then a casing, then the hand pump. The hand pump is fitted there for easy drawing of the water from underground. And then the water passes through a conveyance system into a treatment plant called iron removal plant. In the iron removal plant is divided into 4 chambers. That is, the first chamber takes the raw water, and then in the second chamber it settles. Then in the third chamber, the iron is being removed from the water. And then in the fourth chamber, the clear water enters into the fourth chamber. And then we have a beep tap here where they draw the water from.
Dunyekope, a small, vibrant farming community in the Dangme West District, benefited from the drilling of an iron removal plant and has been awarded by the Dangme West District Assembly as an open defecation-free community under the Community-Led Total Sanitation, CLTS. Before these interventions, this was a situation in this community.
Gafofo alova yi gafofo mane mi na foje den le gbeji pe otoma nya le me ba pe de jesibe kama ma mi die koji pepepe dolere elie mi nwe fine
e cha chiala o no ki no to tin klapo no sro do tin na klapo ha amazro chon ale kana ha ru nya maniji yo ko yo bo blema ma vai no to mi pe de jesibe blema ma agble de nya melo kenika alopezi okata omola gbladire me va me chan vivin po be kenika makata la pipezi mala eva nge sheke nu milala ifi son ko ta mia me choto kra mi mia yo mo de viso bokla ya no ya na ro ofuson
le chie mi nu chan vai lo nya no ne be mi agbo nya fifila ma nya nu chie tepe tonto gblo mi tepe mi ku o shela le fifila egomafie ne yi tepie bi akushi ha afage alo amu fifila ha ele tepie ne yi adu ye minyanyu ha be le afage do amakuli onu madu am ha ona dolle to vo na kama dolle kun blomi le fie to eshimanu me kami gbogbon be ejiva de pota enye no de nya vi oye be kekeli adika ye totonto ha eva kpo dolele kan enanyiku no ekadi no kadi ko de koji ohu ka jogbo vetoma eva toma eku le
WaterAid in Ghana's intervention in this community through partnership with the Damwe West District Assembly and ProNet Accra brought about enormous change and affected all aspects of living of the inhabitants of Dunyokope. The iron removal plant is accessible to all in the community and makes life very comfortable for all.
Equity and inclusion is also a very important approach to this project. And with this, we are working with persons with disabilities, women, children, because we realize that these people are marginalized and most of the time their contributions are not taken when decisions are being made in our communities. So for instance, in our work in the WASH, we have tried to design facilities that are accessible to persons with disabilities, so that in communities where there are blind people, in communities where there are crippled, where there are persons with disability, they can easily access these facilities.
Dajengo, a blind old lady of about 96 years old in Dunyokope, is able to locate the water point with her walking stick and fetch water for use. Jevu Afedo, a disabled young man, is able to easily access the water pump and fetch water. To eliminate issues and diseases related to open defecation, community members of Dunyokope and surrounding communities embraced CLTS. This approach has been adopted to inspire and empower poor communities to stop poor sanitation practices and confront facts about open defecation and its negative impact on the community.
Eva amesiam atadele wo hontilo alo tepekuale aleke necho ezakwiza ha ira kata ya fojifa kocha atapono no eva tie mi monu o va fiale ne watro ako akudwe ko eva fie mia atapono no mia mi va hwedema que unyo ko mi va jegoma mi va jabagbasi mi we maglobe amere sia de hoidem atu ko madenga ka alakola ava mi va kuduo ko nyatawo no mi va wa fojia nyanjijo na mi onto blibu ha ale mi tuogo aya fojire gbejia ifiena echinyo jakpla o dokumenta tako mi gara foji homa mi no mi ojo do feko mi to homa ko gara foji fo homa rambe anu kwade ma mi va pe deje sibe enu enya nu nwe fine.
Evidently, leadership is always by example. The community elder, Emmanuel Eche, has 2 toilet chambers for his household to show how engaged he is to improve his life and that of his community. His facility is well constructed with local material so that no flies enter, and the PVC pipe connected prevents odor. Dunyo, Samuel, and Elizabeth Isu were eager to show and demonstrate how they use their own toilet facility. This award-winning community has engaged all of its community members in enforcing change, thus bringing about a major improvement.